I'm Dr. JoNeil Conley. I've been a registered nurse for 40 years. I am a bullying expert and a bullying magnet. When I was little, I have a different kind of a name, and so teachers would say, "Oh, JoNeil, your parents must have wanted a boy." Cue the childhood trauma. I was bullied by my OR preceptor when she sent me out of the room for a retractor that she knew was out for repair. When I was a director of nursing, we had a toxic CEO. I gained 30 pounds and had 6 ulcers. Every time this happened, I prayed it would be the last time. The last time I was bullied. The last time I witnessed a bully. The last time I had to discipline a bully. But it wasn't. In my career as a staff nurse, as a nurse leader, as a leadership consultant and trainer, and college professor, bullying has continued to plague our profession. But each one of these situations has only made me more committed to my mission of helping nurses protect themselves from the negative consequences of bullying. After studying bullying for a lot of years, I found out what I and others already knew, and what you know too. Nursing has a dirty little secret. We're not particularly nice to each other. We call it incivility, we call it lateral violence, we call it horizontal violence, we call it disruptive behavior. I call it plain old bullying. In 2021, the Workplace Bullying Institute released statistics that identified that 19% of all workers in the United States have been bullied, and 60.3 million workers have been affected by bullying. So if we do the math, and there are 13 million healthcare workers times 19%, that means that 2.4 million healthcare workers are bullied every year. Many really smart people and programs believe that we should just stop the bullying. I have a very different approach. There will always be bullies. Zero tolerance hasn't worked. Anger management hasn't worked. Screaming back at them hasn't worked. Bullies have made you doubt yourself and diminish the care that you deliver. Arm Yourself with Bullying PPE is a 4-week online course. There will be a weekly Zoom teaching class, a private Facebook page where we will actually deconstruct and debrief bullying situations. Now, next time you work with your bully and you take some information into your manager and she looks at it and go, "Well, it's your word against their word," I'm going to teach you how to document that in such a way that your voice will be heard. There will be weekly challenges with prizes and a loving community to help you on your journey. All of this for $297. Okay, listen. You wear personal protective equipment when you're doing patient care to protect yourself from harmful organisms. You wear bullying PPE to protect yourself from the negative actions and consequences of the bully, so that you are not infected with a negative and hopeless attitude. During the course, you're going to be introduced to the Meanness Matrix. You're going to learn the spectrum of bullying. You're going to learn how relevant the bully is in your life. And then you're going to figure out what strategy or technique, what bullying PPE you need to put on for that moment. These techniques and strategies will help you regain your passion and joy for nursing. No more will you let the bully decrease your self-esteem. No more will you let the bully damage the nursing profession that you love. No more will you let the bully degrade the patient care that you deliver. Arming yourself with bullying PPE will empower you to make a difference in the lives of so many people. Class starts April 8th. Go to nursebullying.com and enroll. You owe it to yourself and you owe it to your patients to be armed with bullying PPE. And I will see you in class.